Yeah, hello. My name is Kim Smolderen. I'm an associate professor at Yale University with the section of cardiovascular medicine, and my background is clinical psychologist and outcomes researcher. So globally, PED is prevalent in over 220 million individuals. And we know that its prevalence is increasing both in high, middle, and low income countries, not only due to aging populations, but also due to the increased prevalence of obesity and diabetes. Um, Patients with PED can present in its asymptomatic form, so they will notice that if they have reduced blood flow and a non-invasive test called the ankle brachial index. If they develop symptoms, they might experience pain during walking that is resolved upon rest. Others may also experience atypical symptoms that do not follow that pattern. And in very advanced stages of PED, people may also experience ischemic rest pain, meaning that they not only experience pain while walking, but also um, during the night and during the day more frequently. What we often see in patients with PED, though, is that this pain is not episodic. It has a chronic flavor often. People are dealing with this pain more than 6 months before they really get the right treatment. And even if they get treatment, pain tends to come back and becomes a chronic issues in many cases. So right now, in early stage PD, the emphasis is on cardiovascular risk management, and to resolve the pain, supervised exercise is recommended, which means that people are instructed to walk through the pain and increase their walking regimen at least 3 times a week for at least 30 minutes, where they systematically try and walk through the pain and increase the pain-free walking distance, and the maximum walking distance is what we call that. And so we know this can improve the functioning and prolong the length of or the distance that people can walk. If such programs are not successful, um, it can also be considered to offer an invasive procedure where um, an endovascular procedure is considered, and in some scenarios, surgical bypass, where the blockage can be removed and increased blood flow can be accomplished through that procedure. And that might also result in pain relief. There are medications for claudication pain, Plital. The success may depend on individual factors. And then more and more, as at least in the US, we notice that people do use a lot of pain medications, and some of those medications include opioids. And that is a concerning evolution that we need to study more, because we know that, of course, opioids are associated with increased risk of dependency, also increased risk of complications in this vascular population. So, given the chronic nature of the pain, we're really hoping with this paper to highlight non-pharmacological pain management options that are used in other chronic pain conditions too, such as there are exposure-based therapies, but also mindfulness based interventions, or cognitive behavioral therapy interventions that really offer people strategies to modify their behaviors and come with problem-solving solutions for dealing with the pain, as well as changing their cognitions associated with pain. Well, we really spend some time discussing how comorbidities in this population can make it difficult to assess pain in PED. Oftentimes, people also have diabetes, neuropathy, or osteoarthritis, and that really can change people's pain perception or mask symptoms. Secondly, I think it is important to realize that psychological factors such as depression and anxiety can impact the experience of pain in this population. Pain is processed not at the level of where the ischemia is, but so that's why the role of emotional factors and cognition play a big role in the intensity of the pain experience. So that's why we recommend a comprehensive assessment that takes a biopsychosocial approach. Um, and really opening our mindset for non-pharmacological solutions and taking the problem of pain from a multidisciplinary perspective so that people can have tailored solutions for your pain experience in PD. And I think a lot of research mechanistically is still necessary in this population that can inform tailored treatment development for this population, as is the case for other chronic pain conditions. Yeah, I would say characterizing the pain that people experience, who is most at risk. Are there subpopulations that are at risk? Is it predominantly younger, older? What is their risk profile? So we really don't have a good sense of that. And and characterizing the pain experience in a more longitudinal way requires more data collection as well. We now have quality of life information, but not detailed pain assessment information. So, um, along with the phenotyping of the risk profiles, that would be necessary. And then mechanistically, I think we know very little about influences that impact the pain experience in this population. So, that research needs to be further developed. And then, flowing from that mechanistic research, mind body interventions that could be used to address the pain and alleviate some of that pain, and how we can redirect people from using opioids as a resort to pain relief is also an area that requires more work in terms of research, but also intervention space, I would say. I think that that overlaps with the gaps. So the mechanistic research, um, I would imagine we would look at the role of inflammation, the role of the sympathetic nervous system, and the overactivation, and how that impacts the pain experience in this population. Also, diagnostic methods to really further characterize the nature of the ischemic problem, whether micro circulation is involved and versus the role of macro circulation, and how those play a role in people's pain experience. I feel like that's an area that needs further work as well. And then in the realm of implementation science, testing some of the evidence-based interventions for chronic pain management in a non-pharmacological way, such as mindfulness-based interventions, um, or cognitive behavioral therapy interventions and exposure-based methods are worthwhile translating to this population as well and test it out in the real world.